All right, welcome to the Explainer. Today we're talking about sugar, but, not in the way you're probably thinking. This isn't about what's in your soda or your favorite dessert. Nope. We're going to uncover how a very specific kind of sugar is actually one of the most critical life-saving drugs you'd find in any hospital. So what is this mystery substance? It's called dextrose, and honestly, the name itself is kind of a clue. Dextrose is really just the pharmaceutical, the medical name for something we all know, D-glucose, just a simple sugar. And yeah, you know it as the basic fuel for your body, right? It's that fundamental energy we get from food that powers, well, literally everything our cells do to keep us up and running. Okay, but here's the big question. How on earth does this everyday sugar, transform into one of the most important life-saving drugs in a hospital? How does it even work? That's exactly what we're going to figure out. So, to really get this, you've got to think of dextrose as having like a secret identity. It's got these two completely different faces. It is so much more than just sugar. And this really lays it out perfectly. On one hand, in the world of nutrition, it's just basic fuel for our cells. But then you step into a hospital, and suddenly it's this incredibly crucial medication that can literally save someone's life. It's the same exact molecule, but playing two wildly different roles. Okay, let's get a little geeky for a second. What is it chemically? Well, it's a monosaccharide, which is just a fancy way of saying it's a single, simple sugar unit. And where do we get it? Usually it's made from cornstarch. But for medical use, you can't just scoop it out of a bag, right? It's made into these super specific sterile forms, like sterile solutions for an IV, or even gels and tablets you can take by mouth. So why is this the go-to in an emergency? I'll give you a hint. It all comes down to speed. Let's dig into how it works so fast and why it's basically the body's emergency fuel. Okay, it really all comes down to the brain. Your brain is, well, it's incredibly picky. Think of it like a supercar engine that can only run on one very specific type of fuel, and that fuel is glucose. The catch is the brain can't store any of it, so it needs a constant, steady supply delivered by your bloodstream every single second. So what happens if that fuel line gets cut? That's a condition called hypoglycemia, or low blood sugar, and it's a huge problem. The brain starts to shut down. You get confusion, seizures, even a coma. That's where IV dextrose comes in. Giving it through an IV is like jamming a fuel hose directly into the engine. It completely bypasses your stomach and digestion and gets that critical fuel into the bloodstream like right now. A crisis can be reversed in just minutes. It's that fast. But, fixing low blood sugar is just its most famous job. Dextrose is actually a really versatile medical tool. It does a lot more than just that one critical thing. Yet its toolkit is surprisingly big. Number one, of course, is reversing severe hypoglycemia. But check this out. It's also used to manage dangerously high potassium, a condition called hyperkalemia. What they do is they pair it with insulin, and together they basically force all that extra potassium out of the blood and back into the cells where it belongs. Pretty clever, right? Then it can be used to give basic fluids and calories to patients who can't eat. And finally, it's often the base liquid, the carrier, used to deliver a whole bunch of other IV medications safely. And you can totally tell how important it is just by the way they talk about it in the ER. You'll hear a doctor yell for a D50 push. That's the slang. D50 stands for a 50% dextrose solution, super concentrated stuff. And push means give it now. It's literally the language of saving a life. Okay, but we have to talk about the flip side. This is really, really important. Like any powerful tool, dextrose can be a double-edged sword. You have to be incredibly careful with it because the risks are absolutely real. And a huge part of that risk comes down to this one number, 50%. That emergency D50 solution we just mentioned, it's incredibly concentrated. The medical term is hypertonic, which just means it is way, way thicker and more syrupy than your own blood. And that's where the danger lies. If that super thick, sugary solution leaks out of the vein and into the tissue around it, well, that's a disaster. It's a complication called extravasation, and it can cause severe inflammation and literally kill the surrounding tissue. It's nasty stuff. And it's not just about leaks. There are other major risks. For one, if you give it too fast, you can overshoot and cause dangerously high blood sugar, the exact opposite of what you're trying to fix. The fluid itself can also overload the heart and lungs, which is a big deal for fragile patients. And get this, total irony. While it helps fix high potassium, it can also make potassium levels drop too low, which is a whole other emergency. Now, this next one is a huge one. In patients who are malnourished, especially from something like chronic alcoholism, their bodies are often low on thiamine, which is vitamin B1. If you give them a huge blast of dextrose without that vitamin, you can trigger a catastrophic brain condition called Wernicke's encephalopathy. And that's why the rule in medicine is ironclad. For these at-risk patients, you always give thiamine before or with the dextrose. It's a critical step to prevent severe, permanent brain damage. Okay, so we've been through a lot. The good, the bad. So what's the final takeaway here? What should we really remember about this secret life of sugar? It really comes down to this idea of balance. Dextrose is absolutely an essential foundational drug in medicine. There's no denying its power. But with that power comes a huge responsibility. It demands constant, vigilant monitoring of the patient's blood sugar, their electrolytes, everything. You have to be so careful that the cure doesn't accidentally become the next problem. You know, when you think about it, this whole journey from a simple kitchen sugar to a complex, powerful drug, it really makes you wonder, right? What else is out there? What other everyday things do we just take for granted that might be hiding their own secret life-saving purpose?